Hello, my name is Dr. David Liu. I'm the Chief Medical Officer of Imperial Health Holdings, and I'm here to talk to you today about the triple pandemic. What is this triple pandemic? Well, when we talk about a triple pandemic, we talk about the concern for the recurrence of COVID, RSV, and influenza all at the same time. That is, three very contagious respiratory viruses that can cause serious illness or even death and potentially affect thousands and thousands of people. So why are we concerned about this? Well, we're concerned about this because there's been a serious decline in the rate of vaccination of people for these illnesses. California, for example, we have a very high rate of respiratory illness activity based on emergency department visits. Flu is increasing, RSV has no change, and COVID is increasing. COVID is a new strain as well, something that appears to have some protection with the existing vaccines, but still something that the CDC is watching. So far, as of the beginning of December, there were 78,000 hospitalizations, 4,500 deaths, including 14 children in the United States. Why is this happening? Well, it's the usual. That is, usually prior to the pandemic, we would have these outbreaks of the flu because the weather's getting colder, people are spending more time inside, and people are congregating to celebrate the holidays. How can we prevent viruses spreading? Well, it's the same thing we've been doing for these years and even before that. That is, first of all, washing your hands. Second of all, wearing masks, particularly around babies, older people, and other people who can be vulnerable. And third, equally or perhaps more importantly, is getting vaccinated. Stay home when you're sick. Get tested and seek treatment. Now, as far as it goes for the importance of vaccinations, we've already talked about that. And we also need to be aware that even healthy adults and children can get severely ill. Vaccines are the best way to help prevent or reduce severe illnesses. How do they work? Vaccines help the body learn how to defend itself from disease without the dangers of a full-blown infection. When the body has an infection, vaccines work by imitating it to engage the body's natural defenses. This doesn't cause illness, but it does cause the immune system to produce immune cells to fight off what it thinks is an infection. The body is left with a supply of these cells and will remember how to fight the real infection in the future. These vaccines are safe. Flu, COVID-19, and RSV vaccinations are safe and are the most effective way to keep your family healthy this fall and winter respiratory season. Side effects tend to be mild and temporary. Serious adverse events are rare. For example, you may experience a sore arm or low-grade fever. Getting a flu, COVID-19, or RSV vaccination is a safer, more reliable way for your body to build protection than taking the risk of getting very sick with a respiratory virus. You could still get sick after getting vaccinated, but your symptoms will usually be milder and less severe than if you do not receive the vaccines. Vaccines are available, and what ages are they available for? Anyone who is 6 months or older can get a flu or COVID vaccine. For the COVID vaccine, you have to wait 2 months after your last vaccination for the new booster if you haven't already received it, or 3 months if you got the COVID infection itself. For babies, adults greater than 60, and pregnant people, the RSV vaccination is available. All of these vaccinations are available either at your local pharmacy or at your primary care provider's office. So all of these vaccinations are covered by Imperial. And finally, some people might say, oh, well, I've heard that the flu vaccine is sort of the best guess of experts from the previous season. And in fact, that is true, but we know that for this season, the particular strains that are covered seem to match up pretty well with what's out there. So you can have a pretty good level of confidence that when you're vaccinating yourself against the flu, you'll receive good protection. Thank you very much. Happy holidays and stay safe.